every community is different, so there's not one answer. I know there's been some even comments before we started this session about what's the sort of, solution for this? Well, the solution is going to depend on the situation, um, and everyone is unique. Certainly, having worked in rural communities, there's a phrase that we use there. If you've seen one rural community, you've seen one rural community, and I think this is the same reality. So it's all about developing those relationships. It's all about asking and then taking action once you've sort of learned and understood what the situation is, then moving forward with action. I also wanted to touch a little bit on what Dr. Lem mentioned, because I think sometimes some of this work, and especially if you're working in really northern remote regions, and unfortunately some of the work I had in Nunavut, we're still faced with very deeply rooted colonial structures that affect providers as well as patients. And, I think sometimes we need to recognize this isn't always a comfortable road to travel, but it doesn't make the journey not worthwhile. And sometimes you may be faced with accusations that you may feel you can't, speak to fully. But I think sometimes we pass judgment without quite understanding what may be in the background and going on within someone's life. So when you're trying to be an ally, being sort of humble and also looking with kindness at those around you who may also be trying to do some of this work, because we will make mistakes, or there will be things that we're limited in, and there may be opportunities later to address a situation in a different way.